Hello and welcome to AMM Conversation, the official podcast of the Association of Medical Media. I'm your host, Jason Karras. Season 2 of the podcast is exploring the new normal in medical media. In this episode, we're continuing our conversations around how medical media is coping, adapting, and excelling during this COVID-19 pandemic. Our panelists today are from Elsevier's Global Commercial Sales and Marketing Group. I have with me today Denis Conlon, VP of Marketing for the Global Commercial Sales and Marketing Group, Alejandro Alvarez, Director of Business Development and Strategic Partners, who since January 2020 is working with his clients and partners specifically on content licensing, and Sumner Mering, a longtime veteran in medical media and one of the directors of commercial sales at Elsevier. Thanks for joining me, guys. Let's start the conversation. Denis, we'll start with you. This is a challenging time. What is the biggest challenge COVID-19 crisis has placed on you and your team?
Yeah, no, I think it's a great question and a great spot to start. And we had a little bit of a pre-call prior to this, truth be told, and both Sumner and myself were aligned on kind of a key word that just jumped into both of our heads, and that was uncertainty. And I think, as we all know, basically this pandemic, it's been devastating on a huge amount of fronts. I mean, I was just looking today, we're now up to 5.5 million cases. There's over 350,000 deaths globally. There's been an amazing amount of stress that's been placed on our health system and frontline workers, as everybody is aware. Not only that, but economically, we are definitively in a recession at this point. Unemployment numbers hitting now 30 million in the US. And we haven't seen this here since the Great Depression. So it's certainly tough times. And I think the biggest challenge is that we really, at this point, don't know what the full implications or impact of this pandemic are going to be. And that's not just us, but that's also our clients. So the people that are coming to us with their challenges and looking for us to help solve them, oftentimes we're in a similar place where they are, where we just are unsure of the future, which is challenging. So it's challenging to project where we're going to be. It's challenging to forecast where we think our revenues are going to be. And like I said earlier, it's going to be challenging to predict what the lasting implications of the pandemic are. Now, all of this to say, right, that this situation also presents a nice opportunity for us. It helps us raise the importance of credible content, whether that's based on kind of social media posts or kind of the misinformation that circles around us on a daily basis. It allows us to put a focus and push for more expert-led curation across some of our products. As doctors are more pressed for time, and we certainly feel like we're positioned well to do that. And then additionally, there's been a lot of technological advances that have now kind of really pushed the envelope more so, or have accelerated their development faster than people probably thought before this, things like telemedicine. So we feel like we're really positioned well in this situation, but we're always looking to kind of become more well-integrated, to become more of a partner with our clients. And we're looking forward to when this new normal just either changes or just becomes the regular normal so we can get back to our typical day-to-day.
I think we all are.
Yeah.
With travel restrictions, Sumner, how have you had to adjust short-term, last couple months, but also, long-term, looking ahead?
Yeah, no, that's been a big adjustment the main thing that we try to pride ourselves in is engaging customers, being close to our clients, being able to help meet their needs. And we're used to conferences where we get to shake a lot of hands and talk to a lot of folks up close. We're also used to in-person meetings that allows us to get to know our clients beyond just business. And now that we're limited to just the Zoom meetings and phone calls, it's been a challenge, but it's also been an opportunity to see about how we can engage in a different way. As Denis said, it is uncertain times. Some of our clients are still proceeding with their campaigns like they always have, and we thank God for them. Others are kind of in a pattern. They're waiting to see what may happen with the client in terms of approvals. And so for a sales rep, it's not business as usual of just calling up, saying about the next issue or what the next plan is. They may not know. And we've kind of taken upon ourselves to approach it a little differently. So see ourselves more as a resource. Maybe the call is to be, how are you doing? Maybe the call is, how can we help support what you're doing? Maybe the call talks about resources that we can provide that might be helpful to them. By the way, Elsevier has a great, it's called a Novel Coronavirus Information Center. I recommend anybody to check this out. Tons of resources, over 28,000 articles about coronavirus for professionals, for researchers, for students, you name it. So again, seeing ourselves as a resource and not just the sales arm, I think that's how we're adjusting to the change.
Interesting. Alejandro, are you seeing budget cuts or reallocations? And, if so, are there trends emerging by specialty or by delivery method, print versus digital, et cetera?
A lot of this is certainly happening. There's a lot of change, a lot of shifting of budgets. But we've been in close contact with our bigger clients, actually with all of our clients, in trying to figure out, where they are. Are they going to be cutting budgets or reallocating and so forth? So we're learning that there is definitely a shift to more digital, more trackable, more evidence-based engagement that our clients want to do. But to that point, we're also seeing a lot of clients that are sticking to the tried and true print vehicles that we offer at Elsevier. And so, it's tough really to say if there's a big shift, right? So we're definitely seeing some of it, but I don't think that it's a tremendous shift that's any different from what was already happening over the past couple of years with the budgets and how they're being reallocated towards digital versus print.
Yeah, I can kind of vouch for that. We've trend from print to digital is kind of going on despite coronavirus. But to answer maybe the question about the reallocations, we have had some success stories where clients had planned to do advertising in dailies at a conference. There's no more conference. We've had clients that were doing a special issue at a conference. We've tried to come up with ways to channel that money now back to more general media so they can still get their message out to an audience even if they're not seeing them at a conference. And then on the cancellations, it's a mixed bag. I'd have to say pharma's been a little more consistent with staying with their programs. The device market, especially in certain niches, has been hit pretty hard in terms of, these physicians aren't even going to work. They're not patients. Elective surgeries are down. And a lot of those related areas, we're starting to see people cancel money or at least pause until maybe the fall.
Denis, I'm guessing that you have something to do with digital engagement. Most in the industry and on our panel last month, everyone across the board said that they'd seen at least medium to sharp increases in digital engagement, web, email, app, multimedia. Have you seen this similar increase? And if so, have you been able to capture some of that increase or monetize it?
Yeah, it's a good question. I mean, I think, yes, we have seen that sharp increase. So prior to the call, just doing a little bit of due diligence in comparing same month year over year, looking at things, whether it's visits, visitors, or another measure that we use as a publisher as full text article consumption. And all of those elements are basically doubled, if not tripled. So it's been absolutely tremendous. Now, obviously, it depends on the specialty, it depends on the title. And when you look at Elsevier's entire portfolio, which includes things like The Lancet or Cell Press or some of the other just general specialty-based titles, when you put all of those together, those numbers are gargantuan, right? But I'm talking about going from 10 million visits across the board to 21 million, or full text articles, which, in a typical month are 8 to 12 million, or even, I guess, 14 million, which was what it was in 2019. Now that full text article consumption is up to 53 million. And partly that's just, doctors might have a little bit more time to consume that content. some of the elements that you just brought up too, with regard to open rates on emails improving a little bit. All of that helps in terms of those levels. As far as monetization, yes, I mean, I think our field force is kind of out there as much as possible, touting the fact that we do have now this additional level of impressions where those exist. So I think we're trying to take advantage of having some of these major channels that are that we know healthcare professionals are engaging with across our platform, and trying to tout those and let our clients know that there are areas that now they can take advantage of or further push now that some of their traditional channels like face-to-face meetings with individual physicians are starting to be eliminated.
When you talk about those large increases and surges, spikes in engagement, have you been able to decipher or segment, is that your typical users, regular users, or are a lot of those new users?
That's a good question. So we do see, in typical kind of Google Analytics form, whether they are new or returning visitors. So I would have to dig into that, to be honest, Jason, to see if it's something where it's totally new or if it's a similar audience. My hypothesis would be, with the level of engagement and reach that we currently have, it's not something where there are a lot of new individuals that are now consuming this content. Those people were already engaging across our platforms with that content to begin with. The one kind of little difference I would say is, as Elsevier at large has started to make some of their assets, especially those that are COVID related, not necessarily open access, but free for the public to consume to kind of help push research forward, there might be some more globalization of that, or global consummation of that content that we were seeing before. But that would have to be something that I would have to confirm, to be honest.
Yeah, we didn't get the splits on that by each specialty. So I'm sure the COVID initiatives that they're driving and the content we're making available is part of that increase as well.
Yeah.
And again, this might be a question, this is a consumer question. There's been reports and, a lot of information coming from consumer marketing that, email opens have surged, but click-throughs of those emails and sales conversions have pretty much remained steady. So people are kind of in this, like, I want to consume a lot more, but it needs to be in bits and bytes. I don't want to be deeply engaged. Has that been your experience?
Yeah, I think from an email standpoint, so for us on the Elsevier side, as far as kind of converting to sales, right, that's not necessarily our game. We are distributing a lot of emails to physicians, but for the purpose of, keeping them abreast of the latest information that's been published, right? So if we look at e-table of contents alerts or similar types of content pushes from our engine, if you will, I think those open rates have increased. As far as the click-through on those to certain stories, I think that has remained steady. But we do have a couple of platforms that are within the commercial sales group, like Practice Update, where we're seeing increase in open rates as well as increase in the amount of content that's consumed. So it is, as more people are opening, obviously then they're clicking through on things that are relevant and important to them. And when you look at, again, kind of the end all, which is page view visits, full-time article downloads, as I just was mentioning, some of those numbers are increasing too. So, yes, and yes. I think to also go back to one of the earlier comments I was making with regard to curation, I think a big part of this also is making sure that the content that we are pushing out isn't just more on top of more, right? And again, some of our platforms like Practice Update, who really pride themselves on utilizing experts within the field to select the most important articles and push those out to physicians, so it doesn't become as much of an overwhelming aspect of their job and is more so informative. I think we'll start to drive some other innovations internally or selections for those types of content for additional outreach.
We'll be right back after a message from the Association of Medical Media.
Hi, I'm Jess Campbell from the Association of Medical Media. We're thrilled you're listening to our new podcast series, AMM Conversation. Along with our podcast, AMM is pleased to host a variety of resources for our members, located within the Knowledge Exchange on ammonline.org. Among these member resources are presentations and recaps from previous educational sessions, and our Medical Media Matters fact sheets that cover key topics underscoring the value and importance of medical publishing. The AMM is proud to be there to support everyone through these difficult times, and while we wish we could gather in person as a community, for now we hope you keep an eye out for our next virtual event. You can find out more, access our Knowledge Exchange, and become an AMM member by visiting ammonline.org.
We're back with the team at Elsevier, chatting about the new normal in medical media. Now let's get back to the conversation. Sumner, which department, group, or team has really surprised you the most during the health crisis?
Yeah, I was thinking about this. Actually, I'm going to say it's really the production group, although I'm going to have a much broader focus of when I say production. I know a lot of terms that's being used a lot lately is the supply chain. But when you think about the supply chain of content that Elsevier is dealing with, what's been amazing me is that whether it's the authors, or the editors, or the reviewers, or the pub setters, or the copy editors, ad coordination, down to production, to manufacturing, even to invoicing and billing, we're still publishing all of our journals on time. We're still mailing out all our journals on time with full content like we always have, despite a pretty disruptive market around us. And this supply chain is not just all in one spot. This is all over the world. And for most of these people that are in this chain of production, sometimes they're all working from home now instead of working in an office. So I've been amazed by the fact that Elsevier has been very consistent in its publishing production.
Alejandro, what new ideas have your teams ideated and implemented that likely would not have been considered before this health crisis?
This is actually something we've been really excited about for a little while. So Elsevier lives under the parent company Relics, right? So Relics is Reed Elsevier and LexisNexis. LexisNexis is an information company, information sources for business, for legal, for other things. And one of the things that LexisNexis is involved in is in the healthcare space. And last year, we came under the management of a gentleman that managed the LexisNexis healthcare team in the health markets group. And he said, you should really start to talk to these guys. They've got a lot of information. I think you could really partner with them to create some nice offerings. So we started to take a look at what they had, and what they do is they mine claims data. So they know exactly what doctors are doing, where they're doing it, how much they're getting paid for, and it's based on all of that ICD-10, CPT code, so the diagnosis codes, procedure codes, they have J codes for injectables and so forth. And so what we're able to glean from that information is exactly where doctors are, what they're doing, who are they being referred to by. It's tons of information. And so we found out that they had a couple of offerings that they were working with pharma on, one of them called Market View and another called Early Alert. And in a simplified version of it, what I can say is, imagine that a client has a need to send their sales force into the doctors that are most recently seeing patients for the disease states that they treat. So they would tell the pharmaceutical company, hey, listen, this doctor in your target group has just seen a patient for this disease state last week. You should send your rep in. And it's great information, right? So fantastic, but that's where it ended. But what we're able to do now as a partnership is we can say, we know what that doctor's doing, when he's doing it, and where. Let's layer on top of that information, instead of just telling the pharma company, hey, go see this doctor and send your rep out. Now let's layer some content into that equation that will help to push that doctor's education, his treatment plan, his prescription plan, whatever it is. It will help that doctor, or will help this pharma company to push that content to them. And as Denis mentioned earlier, we are the leading provider of content in medical content in the world, right? So we publish the most medical content of any publisher in the world. It doesn't hurt right now when when we're seeing the Lancet being mentioned across the board. If you actually look at the Johns Hopkins map, the coronavirus map, there's one article listed there, and it's a Lancet article, right? And then, consistently in the news, you hear the Lancet, publish this research, et cetera. And so it's just, I think it's a really exciting prospect. We haven't fully vetted it yet. So we're talking to clients right now about how we would do that. But we're very close to a solution there. And I think that it's a unique situation, right? So I don't think that there's a lot of other publishers that have a sister company that has claims data. And I think the same for them. There's a lot of data providers, but I don't think a lot of those data providers have a publishing company like Elsevier.
It's very interesting, and I've heard that in other industries, or even in just physicians, acceleration. This is a time for acceleration of new ideas or projects that may not have gotten the attention previously, that with some of this downtime or different work environment, that you can do some of these things. And is that kind of what's going on here? This has been accelerated.
So if you think about it, I think it accelerates it, right? It makes it even that much more important because these reps aren't able to go out and see them. So before, we were thinking we'll give these reps content that will help them in their discussions with those doctors. But now that those reps aren't getting into seeing those doctors are, reps are a great resource for these physicians, right? So for education purposes, for knowledge of what's out there to treat their patients with, they're a tremendous resource, and now they don't have them. And it goes back to the idea of why so many people are now opening more email, because they're thirsty, they're hungry for information, right? But the more you can do to kind of curate and narrow that focus for them, understanding what a doctor does and being able to push the right content to them in a timely fashion becomes that much more important today, right? And so there's tons of content out there, and the content keeps growing, right? We see those numbers every, once in a while, somebody will mention how many terabytes or whatever there are of content out there, and it keeps growing. But we just can't keep dumping more and more content on these guys, right? They're now going to be pressed to have less time to spend with their patients, less time to educate themselves about the disease states that they're treating. So let's help them find the right information for them at the right time.
Yeah, I kind of see it as maybe twofold. There's that first step that we've taken in terms of targeting. We want to be able to target these physicians based on their script writing behavior. But this whole idea of contextual relevance, to me, is kind of like the next thing to capture in that marketing plan. It's great that we're targeting them, but what if we could target them and also provide them with contextual information or content that they care about this week? To me, that's a win.
Yep.
Work from home. Tell me about work from home, Alejandro.
So yeah, it's tough, right? So we've been accustomed to working from home at Elsevier for quite a while. So when I came on to Elsevier 5 years ago, I was already designated a work from home employee. I had been a work from home employee for Kantar Media before that. So it wasn't anything new to me, but it is very different being work at home all the time, right? So it does present its challenges, of course, both on the professional front and on the personal front. For me, professionally, the most difficult part about it is just not being in a client's face, right? Like having that back and forth with a client where you can read the body language, you can understand what they're thinking and what they're saying better than you can either over a video call or even a regular call, right? So it presents a lot of challenges. And one of the things that you guys talked about was the travel restrictions earlier. And I think one of the big losses for me from being out there, from going to the conferences and traveling to see clients and so forth, is actually like that competitive intelligence that I get, right? Like understanding what is it that our competitors are doing, and it's a friendly industry, right? So we're all very friendly with each other throughout the industry. So we know, there's something new that they're doing, something exciting that they're doing, but also the challenges, right? Are they shared challenges? Are they unique challenges? I think that's one of the things that has me most uncomfortable right now is that lack of knowledge, right? That lack of how is it for everybody else? Am I alone in this, or is everybody else feeling the same pain?
Yeah, and Sumner, we can maybe go back to you, and you can maybe hit a little bit more in detail, in-person events. Some on the, sales side, that's their bread and butter, right?
Yeah, we're trying to get as creative as we can. I know I was talking to one rep the other day, and he says, I used to go to these conferences and I would prospect aside from just seeing the accounts that I talk to on a regular basis. And I get a lot of new people. And he's having to learn how to prospect using, LinkedIn and just Google searches. And that's a new challenge for him because he's used to getting a lot of new opportunities from a conference. Now he's got to find other ways to get that same information.
Yeah, I was just going to say for us on the marketing side, right? I think this now lack of face-to-face meeting really just kind of opens up a trumpet that a lot of marketers have kind of been blaring for a while, which is you can't just have one approach, right? This needs to be omni-channel. It needs to be surround sound, insert marketing verbose there, whichever one you choose. But you need to address each one of these physicians, not only in a personal way, but based on the channel that they prefer. And yes, there are a huge amount of physicians that are now missing out on that interaction that they would get through those events, whether that's understanding new medications, whether that's the networking that they achieved at that conference, or even if you think about it from a sales rep perspective, now not having the ability to go into that physician's office and being in a place where they can only communicate digitally. Well, now new things have propped up, like Zoom fatigue. Nobody really wants to have those types of meetings anymore. And so it really opens the door for this multi-tiered kind of communication plan where you really need to address these folks, not only through print channels, but through digital channels, wherever they may be. And now we know that that's, not going to be in Orlando. So you got to find a new spot and a new way to address them.
Any intelligence from your side of when we might start to see in-person events, or are the associations and the meetings teams really making contingencies for fall? Are they making contingencies, late fall, December, or 2021?
Well, I can tell you from the societies that I work with and talk to, they're already starting to cancel some of their events, at least their live events in the fall. I think RSNA just recently canceled, which is late November. But they are going to be doing it all online. So when I say cancel, I have to be careful here. It's just canceling in person.
Yep.
And how we in ad sales work with our society partners to develop new opportunities that are more online based, that's what we're doing currently. And so with some of our other societies, they've reached out to us and said, we're going to be canceling this, but what can we do as an alternative to some of the on-site promotions that the journal was participating in? And we've had to get creative. We used to do a little jump drive abstract supplement at a conference that was distributed to attendees. Well, now we're customizing that to a target list and polybagging it with the journal in the same or following month. So there are some new ideas that are helping us come up with a way to still get the content out to the right people. One society, by the way, even suggested they would send us their attendee list or their registered list as a way that we could market just to them if somebody wanted to hit the same people that were planning to come to the show. Very
gracious of them, yeah. Out of the box thinking, again, a crisis, turns some new ideas. I heard
that's something a little earlier, just so we were on the topic of this whole idea of working from home. One of the things that I run into a lot when the reps I talk to is they've got kids at home and they're saying that their schedule is crazy. They're being the mom, they're being the school teacher, they're being the maid, they're being the cook, they're doing everything. And one of the things that we've had to do at Elsevier is give these employees a lot more flexibility in terms of their time. So if you've got class, it's at a certain time during the day, but you can find some time at night to catch up, or even if you just need to take some time off. Elsevier is trying to be pretty flexible to help people do that.
Yeah, that's great to hear. Anything else on the company culture, cohesiveness? I've heard, it's difficult, you can't get donuts and everybody sit around the office or, take that coffee or smoke break. Although I don't know if that's appropriate for a medical media podcast, but,
Hey, we did something recently that was kind of fun. The sales team wanted to come up with, we have these Zoom meetings now every other week, and it's a chance not only to talk business, and we do share success stories, we share challenges with everybody, but we're also trying to make it a social time. And so we've been sharing a little bit about each individual, and I'll be honest, we're actually getting to know some of this, the folks that are on this team even closer than the days that we were getting together once every other month. Another thing that I thought was interesting is the team decided to submit a TikTok video. So everybody contributed their own little piece of it. Somebody edited together, and somewhere out there on TikTok is the Elsevier display ad sales team.
I've been somewhat blown away by the way that the senior management team at Elsevier has really addressed the crisis. I think they've taken a fantastic approach of almost over communicating, but from a employee standpoint, it's been fantastic. I think they've had a multi-pillared approach of addressing needs of the community through developing their COVID-19 resource center. I think they've done a fantastic job in terms of taking care of their colleagues, like Elsevier was saying, or like Sumner was saying, in terms of providing very lax work-life kind of flexibility as far as when and where you have to work, in terms of the typical hours of the day, which has been great. And then also still being very customer facing, right? And telling everybody, that it's not so much about the sale at a time like this, but is really about improving that partnership. So ensuring that the communications are still strong between you and your customers, and not pushing them for dollars as much as insight, information, and again, excelling that partnership forward. So once we're in this new normal, they realize that we were there to help and not there to sell.
Yeah, it's a different conversation and a turn of that message that, if everybody was sitting in the same room, it might be easier to embark or impart that. Doing it over Zoom or through email, you got it, the nuance of that message probably is a little bit more difficult, right, Sumner?
Yeah, I mean, we've reps that are calling on clients, sometimes they're dealing with the same life issues that the sales reps are that I was talking about. Mm-hmm. And just be very sensitive to that. One rep talked about, being sensitive to when I can even call and what makes sense for them. And if you know them well enough, you can kind of learn where it makes the most sense and what they need. But as Denis alluded, we've got to make sure that we are information providers and not just seeking a business every time we call.
Does anyone have one new thing, a new workflow, a new technology that you've instituted and you think will continue in your organization or your department beyond the health crisis?
I mean, I think the silence maybe comes from the fact that it's these video conferences, right? So I think we have become very accustomed to them now, right? They're almost like they're just a way of life now for us. So I think we have started to use them much more now than we used to. I think we've all become more comfortable with them to the point where, as Denis mentioned earlier, there's some fatigue to it. I would certainly say that at the beginning of this lockdown, that everybody was jumping onto the Zooms or the Microsoft Teams or the Google Meets and whatever, and they were happily showing their videos and sharing a smile and so forth. But I think as time has gone on, that's stopped a little bit, so that you see less and less of that, and there's more just this audio on these meetings. But I think that has definitely become a part of our business now. It's something that we're going to continue to do. I think we also are using the IM systems of those systems much more than we did in the past. just checking in on our colleagues, on our teams, et cetera, to see how they're doing, and maybe using it more in a less professional manner than we had in the past, right? Just one of the things I thought was funny is that I've actually, not only have I gotten to know my colleagues better, but their families as well, right? So like knowing who, how many kids they have and who their kids are, their wives, their husbands, et cetera. But I thought the funniest thing was like one time a kid came in and was like, "Hey, Dad, is that Alejandro? Is that guy Alejandro?" And he's like, "Yeah, shut up." He's like, and I think he was like ready to tell him, like, say something that this guy had said about me before. And it was really funny, right? Because obviously our families know the people that we work with through us, and we all have opinions of them, and we share and so forth. And I think it's interesting to see that grow, that your knowledge grow of those things that weren't evident before.
A new definition of work-life balance during the pandemic, right?
Yes, exactly. Yes.
So continuing along those lines, Alejandro, I've heard that you have a little story about something that has not worked well during the pandemic. You want to maybe share that?
Yeah, definitely. So as we noticed at the beginning of the call, I've got some technical challenges. So how am I supposed to function in this environment, right? So now that we're home, and it's crazier because I've got a new laptop that I got just a month before the shutdown came, and for some reason it's very touchy. So it's very sensitive about letting me do both audio and video on it. So I have to do my audio on a phone and my video on the laptop, and it's tough, right? So the IT departments are very helpful, and it just, but it's frustrating, right? So you have a new laptop, you've got all this technology, and the things that you critically need now, your phone and your laptop, for some reason at times aren't working, and that gets to be a little bit frustrating at times.
Interesting, yeah.
Yeah, that's where the patience and flexibility comes in.
Yeah. 2 words everybody uses to describe me.
Yeah.
I wasn't going to say it. You said
it. Denis, we'll do the final question. We'll start with you. Denis, what are you most looking forward to when the stay-at-home restrictions are lifted and the economy really starts to open up, and the offices might start to open up, at least in under newly imposed guidelines?
Right. Yeah. I don't. Is this a fair question to ask right now? Is the light close enough that we can start seeing it? I don't know. But yeah, I think, and I would imagine Sumner and Alejandro will probably echo this. But our business is really reliant on those face-to-face interactions, whether that's internally or externally with customers, for some of the reasons that Alejandro was mentioning before. Is it just the networking? Is it the insights that you gather? Is it the competitive intelligence? Or is it just the personal touch, right? I mean, I think media sales is one that's built on relationships. And I think some of those barriers that have now been put in place, even though we can still connect and communicate, it definitely has caused some rifts and some challenges. So I'm really looking forward to being able to head back into the New York office, being able to travel again a little bit more globally, to see customers, to see internal colleagues as well. I think we are still in a business where we get a lot of, at least from my side, a lot of joy from those face-to-face interactions. And as much as a kind of stopgap this Zoom is, I'm ready for the other side.
Sumner, what are you looking forward to?
Yeah, I can echo that. I know I used to say, "Oh, I'm traveling so much. My gosh, it's just too much travel this month." And now I'm kind of looking forward to the day when maybe I get to go to a conference again, because I actually enjoyed the time with colleagues and with the clients that we work with. And I do miss that. So getting back on the road, I actually think it would be a good thing. Hopefully restrictions will be lifted and we'll all be a lot safer to be able to do it.
Alejandro?
The foundation of an outside salesperson is the relationships that we build, and we miss those, right? So they're not gone, but they're definitely not the same as they used to be, and we're not able to cultivate them like we used to. And I think just getting back out and seeing our clients and seeing our colleagues and the others in the industry is just going to be really nice to have that again, to experience that.
That is all for this episode of AMM Conversation, official podcast of the Association of Medical Media. Thank you for listening. Make sure to join us next week as we continue exploring the new normal in medical media. More information on the new normal in medical media is available at ammonline.org. Make sure to listen and subscribe to the AMM Conversation on Apple Podcasts, Spotify, Stitcher, or wherever you enjoy podcasts. The views, thoughts, and opinions expressed in this podcast belong solely to the guests and not necessarily to the host, AMM, or any other group or individual.